Hi everyone, I'm Dr. Matthew Stay from National Pike Chiropractic, and this month is all about a common shoulder issue that we see in our office. Now, shoulder pain is one of the top reasons that people will come into our office, but did you know that non-traumatic shoulder pain often follows a very predictable progression that we call the shoulder pain continuum? Now, to fully understand this progression of the shoulder pain continuum, it's very important that we have some basic knowledge of the shoulder girdle anatomy. So the shoulder girdle includes the shoulder blade, the humerus, which is the arm bone, and the clavicle or the collarbone. Now, the shoulder girdle is the most mobile joint in the body. However, unfortunately, the body will sacrifice stability in order to achieve that mobility. Now, the shoulder pain continuum follows 4 stages. The first stage is what we call scapular dyskinesis, or abnormal movement of the shoulder blade. The second stage is shoulder impingement, or pinching of the structures underneath the roof of the shoulder. The third stage is rotator cuff tendinopathy, which is the gradual wear and tear of the tendons due to overuse. And then the fourth stage is frozen shoulder, which is the loss of mobility due to stiffness and inflammation. Early recognition and treatment can stop this progression, and we're going to show you how we evaluate and treat each stage in this series, starting with scapular dyskinesis right now. Now, the shoulder blade or the scapula, it should glide smoothly along the rib cage, as we move our arm through a range of motion. And so with scapular dyskinesis, is simply when the shoulder blade tips or wings or just moves unevenly, thereby altering these shoulder mechanics. And we're going to demonstrate some of those evaluation and treatment techniques right now.
All right, so for scapular dyskinesis, how we evaluate this, we look at 3 things. We look at, we do a postural assessment, we palpate the muscles, and we'll do a movement assessment. So for a lot of individuals who would demonstrate this scapular dyskinesis, they will present with some tenderness right in this area of the shoulder, and that will correlate, and we're going to turn Noah here. That would correlate with some winging of the inferior tip of the shoulder blade, where this starts to peel away from the rib cage. And another thing that you'll start to see if you just look at a simple postural assessment, where I get right at the very tip of the shoulder blade on the left and on the right, and you can kind of see that this left finger is a little bit raised compared to the right, because that's suggesting that the shoulder blade is starting to roll away like that. So that's just at the surface. That's something that we would do and start to identify these things.
A complete treatment approach for scapular dyskinesis would include adjustments to the cervical and thoracic spine, as well as the shoulder girdle. We would also perform myofascial release to the indicated areas, and this is typically performed in the pecs, the biceps, and the traps. We then support the manual therapy work with simple exercises that can be performed both in the office and at home to support continued recovery. And lastly, as a full comprehensive game plan for your recovery, it is necessary to discuss specific lifestyle factors like posture and workstation ergonomics that can be quietly contributing to your problem. As you can see, correcting scapular motion is the foundation to preventing bigger problems. If left untreated, this can easily lead to the next stage in our shoulder pain continuum, which is shoulder impingement. And we're going to cover that in our video next week. As always, I'm Dr. Matthew Stay from National Pike Chiropractic, and we'll see you next week.